cannabis. The number one condition is pain. Cannabis is useful in relieving people's pain. It's particularly effective in relieving pain from connective tissue disorders, from arthritis, from fibromyalgia, from systemic lupus, from reflex sympathetic dystrophy, a whole host of conditions that we don't really understand very well. People seem to get good relief from cannabis. People are able to decrease the amount of opiates that they're taking, and in some instances to stop taking opiates entirely for pain control. The first modern research that was done on cannabis was done in 1949 that demonstrated its usefulness in treating epilepsy. I have a number of people who don't have epilepsy when they use cannabis regularly. The founder of modern medicine is a physician named Sir William Osler, who was prominent around the turn of the 19th to the 20th century. He wrote the first textbook of internal medicine, and in that textbook he said that cannabis was the most effective medication for the treatment of migraine headaches. And I certainly have a number of people with migraines who get substantial relief or even prevention of their migraines by consumption of cannabis. Other conditions that commonly respond favorably to marijuana include depression. It helps people with sleep, it helps their appetite. It's also very good in treating GI symptoms, nausea, diarrhea. It's excellent for treating Crohn's disease. We did a little study of people with Crohn's disease and found that many of them were able to stop using steroids and stop using other medications that they had taken for their Crohn's, that they had less diarrhea, they had less abdominal pain. It was a true miracle for them. There's a list here of conditions that was originally developed by Dr. Todd McArea, who was a pioneer in terms of medical marijuana. He actually worked for the National Institute of Mental Health, and his job was to give out grants for doing studies on cannabis. He thought he was there to find out how cannabis was useful to treat medical conditions. NIMH thought he was there to hand out grants to see how dangerous it was. This was a marriage made in hell, and he did not stay with the National Institute of Mental Health for very long. Cannabis is seen as a neuroprotective agent, and we have found that it has provided benefits for people with multiple sclerosis. It certainly treats their neuropathic pain and their muscle spasm, but more importantly, people who were placed on Sativex, the tincture of cannabis, in early studies in Great Britain have remained on it for years and years. And rather than progress, their multiple sclerosis has stayed the same, suggesting that cannabis may not only be effective in reducing the symptoms, but also in slowing the progression of disease. It's helpful in dealing with the anxiety of people that have Alzheimer's disease. It's helpful in dealing with the muscle spasms that are associated with Parkinson's disease. When it comes to psychological illnesses, cannabis is useful in not only treating depression, which I already mentioned, but also bipolar disorder, which is depression and mania. It's useful in treating attention deficit disorder, post-traumatic stress disorder. There was a study done at the Max Planck Institute in Germany a few years back that demonstrated it was useful in reducing fearful memories, so that might suggest why it is useful in alleviating PTSD. This is extremely important at this time when we have so many people who are serving multiple tours in Iraq and Afghanistan. The Pentagon has projected that at least a third of these people, and I think that that is a very conservative estimate, will come back with the symptoms of PTSD. As a matter of fact, in regards to PTSD, both the Israeli government and the Croatian government have given their troops cannabis for treatment of PTSD. The list just goes on and on. Many conditions cause pain, serious conditions. Ankylosing spondylitis, which can actually turn you over, make you bend over in a crippled position. People who have failed back surgery, people who have herniated discs, people who have chronic dislocated shoulders. All of these people get relief from cannabis, and they find that the cannabis provides that relief with fewer side effects than the opiates do. Another thing that is sort of counterintuitive where cannabis is useful is in the treatment of asthma. You may have seen the ads for Advair that say it's both a bronchodilator and an anti-inflammatory. Well, so too is cannabis. This is why there were numerous marijuana cigarettes on the market in the 1920s for the treatment of asthma, specifically for the treatment of asthma. So, as I pointed out by holding up this list, the list of conditions for which cannabis is useful is extremely lengthy. That's a quick overview of some of the conditions that cannabis is useful in treating. Most people tend to take cannabis